Fighting in Mozambique's conflict-hit Cabo Delgado continued on Monday. That's according to a security source directly involved in efforts to secure the town. The government confirmed on Sunday that dozens of people had died, including 7, when their convoy of cars was ambushed during an escape attempt. ISIS militants say their fighters carried out an attack in the northern Mozambique town of Palma. It says that at least 55 people were killed in buildings, including factories and banks, taken and destroyed and vehicles seized. Those killed include a number of soldiers. The ISIS claims, however, could not be independently verified. Thousands were displaced and some are still missing. The town is adjacent to gas projects worth about 900 billion rand, with a three-pronged attack on Wednesday last week. Portugal says that it will send troops to its former colony Mozambique following an insurgency attack on a town in the north of the country. Meanwhile, nearly 670,000 people have been forced from their homes since the conflict broke out in the northeastern Cabo Delgado Province in 2017 between non-state armed groups and the army. The number of internally displaced people continues to rise massively, and the needs of the population remain unmet due to strict administrative constraints. For more on this, we're now joined via Zoom by Jonathan Whitall, who's the director of the analysis department at Médecins Sans Frontières, or Doctors Without Borders, MSF. He's just returned from Cabo Delgado after spending a month assessing and visiting MSF projects there. Thanks very much indeed for joining us, and welcome to the program.
Good evening, Peter. Thanks for having me, and good evening to your viewers.
All right, so tell us, what did you see on your visit?
What I saw during my time in Cabo Delgado was a worsening humanitarian situation. The situation across the province is becoming worse in terms of humanitarian needs. As you mentioned, there's over 500,000 people that have been displaced already in the fighting. Many of them have suffered extreme trauma. They've walked for days to find safety. They arrive in places around Pemba, which is the capital of the province. They arrive tired, thirsty, dehydrated, hungry, having experienced severe trauma. In the camps around Pemba, the situation can be very difficult. The conditions are overcrowded. There's poor shelter, lack of access to safe drinking water. And this is the condition in the places where people have found safety. There's many others that are in other parts of the province that don't have access to healthcare. Health workers have had to flee the violence in many of the parts of the province. Health facilities have been destroyed, and people lack access to basic necessities like food, water, healthcare.
And I'm just wondering, as Médecins Sans Frontières, what kind of medical interventions are required? What kind of injuries are you seeing, and medical issues that you're having to deal with?
What we're doing as Doctors Without Borders is scaling up our emergency response to meet the needs of displaced communities. So we're really providing access to life-saving medical care, primary health care. For example, the province of Cabo Delgado has malaria, so we have patients that suffer from malaria. The conditions in the camps where people are displaced is often extremely difficult with regards to sanitation and access to water. So we provide both access to water and sanitation, but we also respond to the medical needs that are caused by poor conditions in the camps, such as cholera. So our response is really to provide the emergency needs for the displaced community and for communities that are still in areas that are affected by insecurity. And there we're providing access to basic healthcare. So you can imagine populations that have no access to healthcare. We have pregnant women that have complicated deliveries. We have people with malaria, some cases of cholera. And of course, these patients require emergency assistance, and they often don't have any access to healthcare. So our priority is really to reach them wherever they are and to touch the most vulnerable.
I'm always mindful of children in situations like this. And I would imagine this is something that's a concern for you, and you're seeing a great need.
it is a concern for us. I heard stories of families that were displaced during the violence that witnessed extreme acts of violence and trauma. Of course, this impacts on children particularly. I heard of stories of families that walked for days to find safety. Some of them were separated while looking for safety. Many of them hid in the bush for days. Children that had to hide from the fighting to wait for a safe moment to move, often separated from their families. So I think, yeah, children have suffered extreme trauma, and as Doctors Without Borders, we're looking at the mental health needs of the community, and of course, children are a priority in this regard.
What do you need to do your job? What kind of help and assistance do you have enough supplies? What can you get still?
So I think the first thing to note about the humanitarian response is that overall the response does not match the level of the needs. So the level of the response is insufficient in Cabo Delgado. The overall humanitarian response is not up to what the needs are on the ground. So I think this is the first point around the overall humanitarian response. And there's many reasons for that. Cabo Delgado is not necessarily a forgotten conflict. There's plenty of people that pay attention to it from an economic point of view or from a political point of view, but it is a neglected humanitarian crisis. And we haven't seen donors that have been interested, for example, in necessarily responding to the needs of the displaced community. As Doctors Without Borders, we have been able to scale up our response. We rely on donations from the public. We are independent in our response, so we don't take money from governments for our work in a place like Cabo Delgado because of the political sensitivities. But we face restrictions, for example, in bringing in supplies, and in bringing in people. So visas are a challenge. So our ability to scale up is constrained by some of these restrictions imposed on us by the government.
As these attacks are scaling up, your own safety and security must be an issue.
Yes, so we take the safety and security of our team very seriously, and one of the ways that we work to ensure our safety and security is by making sure that the communities and population understand that as MSF, as Doctors Without Borders, we are independent and neutral in this conflict. We are not there for any other interest but to save lives. And this is something, the principles by which we work, and the way in which we enact those principles by reaching the most vulnerable and providing quality healthcare in an emergency situation is one of the ways that we try to increase our acceptance and ensure our security. And of course, insecurity across the province is a concern. It's something that is cutting off large parts of the province from receiving assistance, and this is something that needs to change. We need to be able to reach people where they are and ensure that they receive the assistance that they need.
When people are fleeing for their lives and trying to literally just survive, the last thing they worry about is COVID-19, and yet we are in the middle of a pandemic. How is this impacting what you're able to do and what you're seeing?
Yes, COVID-19 is no part of the globe has escaped the COVID-19 pandemic, including Cabo Delgado. It's extremely difficult to respond to COVID-19, to tell people to wash hands, to keep a social distance in a context where there is no access to safe drinking water and people are living in overcrowded conditions, having just fled for their lives from violent attacks. And this is something that is, of course, of concern, along with a host of other medical emergencies, such as cholera, such as malaria. So we're really trying to tackle all of that. But in order to respond to COVID-19, we also have to respond to the living conditions that people are experiencing. And this requires adequate shelter. It requires adequate access to water, to sanitation. And these are the basic needs that need to be met in the province.
Will trying to get vaccines be part of the interventions for you going forward?
I think getting vaccines for all vulnerable communities is something that we want to see and that we need to see. And this is something that we would hope for Mozambique as much as we do for other parts of the world where there are vulnerable communities that are not only suffering from the pandemic, but have on top of that additional emergencies that they're having to deal with, such as what we're seeing in Cabo Delgado.
What assistance do you think the Mozambican authorities can be given to, A, manage just the medical emergencies that you're busy trying to grapple with, but also create, I guess, a sense of, I don't want to use the word calm, but at least something to be able to at least start to deal with the issues?
I think what's been incredible about my visit in Cabo Delgado was seeing the solidarity shown by communities themselves to those that have been displaced. I know you're asking about the Mozambican government, but I think the Mozambican people have shown immense solidarity and compassion to people that have been displaced in the violence and that are fleeing to find safety. We work alongside the health workers that are part of the Ministry of Health, and many of them have faced extreme obstacles in trying to carry out their work, including having themselves to flee from violence to find safety. So there are very, very real challenges that the Mozambican authorities and health authorities, in our case, who we're working with, have to grapple with on a daily basis. And we try to work alongside those health workers to address some of those challenges. But what needs to happen on an overall scale is difficult for me to say as Doctors Without Borders. What we end up dealing with is the consequences of failures to address some of the root causes of these problems.
So a lot of what we've been talking about is dealing with physical problems, but I would imagine that psychological trauma is also part of this.
Absolutely. The mental health impacts of the violence and the displacement, it's not only the moment of displacement and the moment of experiencing such extreme violence that has an impact on people's mental health, but it's also their journey to seek safety, the difficulties that they face. As I mentioned, many people have been hiding in the bush for days before they've been able to even move. We've seen that in recent weeks with some violent clashes, that people hide, waiting for the violence to subside, then walk for days to find safety. This in itself has a big mental health impact. And then, of course, when they arrive in the place to find that safety, what they find is conditions that are in many cases unbearable. So the mental health impact is ongoing from the point of displacement up until the place where they supposedly find safety, but in actual fact find horrific living conditions.
Jonathan Whitall, we're going to have to leave it there. Thank you very, very much indeed for giving us a sense of just how difficult things are for the people in Cabo Delgado, and let's hope that the international community focus more on what's happening there and assist. Thank you so much. Absolutely. Thank you, Peter, for having me. All right, that was Jonathan Whitall, who's the director of the analysis department at Médecins Sans Frontières, or Doctors Without Borders.